year 2023 comes to an end, it is a good time to look at the current state of Nigeria's health sector in the midst of global crisis and the dawn of a new government. Experts says the migration of health workers is on the increase as most health workers resort to seek for greener pastures overseas. Our correspondent, Bosan Yakusak, sent in this report. The coming of new government has given Nigerians hope, especially in the healthcare sector. This retrospective review shows healthcare sector faced several challenges, which has been exacerbated by economic headwinds. Ensuring adequate healthcare financing to meet the needs of the growing population is one of the issues. Nigeria continues to experience poor health outcomes such as high maternal death rates and poorly functioning primary healthcare (PHC) facilities. As Nigerians look to the year ahead and reflect on the past 12 months, there have been some significant achievements in the health sector, such as the signing of critical bills like the Mental Health Act and the initiation of the HPV vaccine rollout. The international migration of healthcare workers has seen a significant surge in the recruitment of health professionals trained in places considered among the world's low and middle-income countries like Nigeria, which presents a pressing global health concern. Statistics have shown that an estimated 200 resident doctors leave Nigeria every month in the last 2 years. The World Health Organization estimates a shortage of 18 million health workers by 2030, and these are due to several factors.
Among them is welfare, welfare and security generally. Because if you have a doctor, for instance, who is in the country and is unable to really afford even the basic to pay your children's school fees, for instance, because you're earning something that really you cannot afford to keep your children in private schools, private primary schools or private secondary schools. The public schools we attended now are nothing to write home about again. So now have it that you have to actually look towards private schools, for instance. So how many, with what you're earning today, can afford to train 2, 3, 4 children?
Actually, we cannot say everything is perfect. Of course, we are bedeviled with the issue of insecurity. We have not come out of that. This has been our call always on the government, that the government needs to improve on the security situation in the state. We are aware that some local governments are difficult to penetrate. And then some of the primary healthcare centers in the rural areas, they are difficult to access. The healthcare workers themselves are afraid to go to those type of places. So talk less of the patient. So you can't admit a patient in those facilities. Now, even the healthcare worker that is in that facility is also afraid.
Another major challenge in this regard has to do with the patient-to-doctor ratio as recommended by the World Health Organization, which is one area Nigeria needs urgent improvement.
Quality of service you're getting is another. One of the things people are running away from the public sector is because of this watered down quality of service. And then the public sectors are overburdened with a lot of people. You visit the government hospitals and you see the number of people waiting to see a doctor. It's just about what we keep saying. The manpower needs is there, and it's worsening.
These medical experts are optimistic that the President Bola Tinubu's government will bring about the desired change, especially as it came with the renewed hope mantra.
Well, we are always optimistic, but in your optimism, you give a period of time. From this time to this time, if you see that our optimism is yielding something good, we want to see whether the government is going to keep her promises. We are optimistic that they will do something good, but we are giving them time to see whether they will do it or they will not. If they don't do it, then we'll become pessimistic.
In public hospitals. So a lot needs to be done, and I'm happy that the Current Minister of Health had mentioned about reforms, bringing in reforms into the health sectors and ensuring that the private sector also is carried along. Because if the public sector cannot do it on its own, The problem with the private sector now is going to be the cost. So many would have wanted to go to the private, but of course the cost, because the cost of running a private hospital you cannot actually compare. It's so high such that the person doing that has to factor that into his bill.